Well, it's an honor. It's an honor to be here with all of you. It's a real honor to be able to set up the next part of our program today, especially the part that's going to talk about the human aspect of healthcare operations, because that is an area that my husband Mark and I have a bit of experience in. 25 years ago, as parents of a 33-year-old young man, brand new father, great guy, we got to experience healthcare, frankly, at its best, but also at its worst. Patrick went into the hospital with a diagnosis of the autoimmune disease ITP. Mark and I flew to be by his side, and we spent then the worst 8 weeks of our lives with him as he passed away. But during those worst weeks of our lives, we got to see this delicate balance of the science and the art of healthcare, of patient care that you all are experts at. We got to experience the science through the incredible clinical excellence of his nurses, but frankly, we expected they would be that good. What we did not expect was the art. We did not expect the compassion, the sensitivity, the kindness that Patrick's nurses showed to him as well as to all of us in our family. And when he died, our hearts were so filled with gratitude to his nurses that we had to find a way to say thank you. So we created the DAISY Award for Extraordinary Nurses. We named it DAISY. It stands for Diseases Attacking the Immune System, which is what took Patrick's life. And we named it DAISY to keep us rooted in our experience with Patrick's care. Created the DAISY Award because we figured, well, we can't be the only people in the world that are grateful to nurses. We should find a way to make it easy for patients and families to express their gratitude and, really importantly, share their stories of extraordinary care. When we started this program back in 1999, we thought, we'll say thank you to nurses in 5, maybe 10 hospitals around the United States, and we'll go back to doing what we were doing before Patrick got sick, and we'll feel better. Today, 25 years later, we are partnering with over 7,300 hospitals, nursing schools, and every other kind of employer in nursing, not only throughout the United States, but in 42 other countries as well. More than 3.2 million times, someone has stopped and taken the time to share their story of gratitude and talk about the difference a nurse has made in patient care. I don't know how many of those stories Mark and I have read, probably thousands, Mark. But what we see in every one of those stories is that DAISY-worthy care happens in those moments when patients and nurses truly connect human being to human being. And the only way that that connection happens, the only thing that brings those moments to pass, is when nurses have the time to make that happen. symplr helps make that time happen. It is the reason we are so dedicated to this company and would fly cross-country to be with all of you and with all of our symplr friends. symplr makes that time happen, and what we so love is that Dr. Carleen Kerfoot, who was the chief nursing officer at symplr until she broke our hearts and died last October, and was on our DAISY board, she called those moments the moments that matter. And she was so right. Those are the moments when we as patients and families feel cared for, we feel safe. Those are the moments that make a huge difference in our patient experience and that we can't wait to tell other people about, because we never forget those moments. Those are the moments when we feel nurses practicing not only with their brains, but also with their hearts. And so those moments that matter mean the world to all of us when we are in your care. And I am so grateful to symplr for taking a number of those moments and bringing them to life in beautiful videos that you can see on their website, nurses.com, and they're going to show us one right now. So, Carrie, can we hit the video?
I would like to nominate local RN Sarah Palmer for a DAISY for a specific patient story, but also because she's exceeded so many expectations as a new RN. She is such a hard worker and one of the best team players I've worked with.
My name is Sarah Palmer. I am a float pool nurse at Portland Providence Medical Center. Jeff was one of 4 patients, and I remember that the other patients were super easy. He'd been at a homeless encampment. No one knew his name. No one could tell us anything about him. We had no medical history. Everything we figured out was by basically looking at him right now. He was in a COVID room and isolated. He wasn't able to speak. He wasn't able to really follow commands. He was also HIV positive and had AIDS and had thrush. And it was so obvious that his body was breaking down. I remember looking at his eyes and trying to figure out if he was understanding what I was saying. That was the constant struggle of the night when I was sitting with him as he was passing. I was so at a loss for what you do in that moment. I thought singing would be comforting, so I sang a little bit. So much touch is clinical. Hand-holding is purely an act of comfort. You do not have to be good. You do not have to walk on your knees for 100 miles through the desert repenting. You only have to let the soft animal of your body love what it loves.
Her story is the epitome of being a nurse. She took a very vulnerable person who needed care, and she treated him with such dignity and such compassion. And that is very much what Providence is about.
Nurses are essential to what our intentions are in taking care of hospitalized patients. Not just nursing, but healing. We don't have a measurement tool to have a measured score with compassion. The work that we are doing within Providence right now is centrally aimed at enabling clinicians to be able to have more time bringing compassion to the human being that we're caring for who is suffering, freeing them up for the incredible resource of their critical thought, their critical skill and decision-making abilities. And when administrative tasks consume too many minutes or hours of their day, it pulls them away from those 4 pieces of not just nursing, but healing.
There is so much activity during the day, and it can be really hard to fit in anything that isn't what's on the schedule. And you just need time to do it. You need time to be patient with patients.
Moments that matter. Thank you to symplr for creating this video and many more that tell the story of Daisy nurses in a way that touches our hearts, and all inspired by our dear friend Carlene. And for the nurse leaders in the room, I have to tell you the next thing we're doing in Carlene's memory, in addition to these beautiful stories, is a new grant, an education grant for nurse leaders who are advancing patient care through technology. And this will be launched June 1st. It's a partnership between symplr, the Daisy Foundation, and AONL, the American Organization for Nursing Leadership. So nurse leaders, please keep your eye out on our website and on symplr's. The applications open June 1. Before I turn this over to our next panel, who's on the screen already, I have to say one more thing. The Daisy Award would be nowhere were it not for a chief nursing officer who met this grieving couple right after their son died, heard our story, heard our desire to say thank you to nurses in this unique way, and she said yes. That chief nursing officer is with us today, Dr. Susan Grant. She is now the chief clinical officer of symplr, as you know, and has now the opportunity to make moments that matter possible for hospitals throughout the United States in a much even bigger way than she did for us. Thank you, Susan. We will never know how to say thank you enough. Thank you.